Hi, this is Frank with a Frank Opinion. Over the next couple of weeks, I'm going to be doing a series of videos on our healthcare system, or lack thereof. But I wanted to start today with letting you know that my family has been battling a health insurance company for over 8 months. And what I have here are files. They're thick files dealing with this particular healthcare insurance situation, which was caused by an inadvertent error by a provider, not by us. The provider did not provide all of the information on a particular day that was required, unbeknownst to us, and claims began to be denied, even though a month later the insurance company was provided with the documentation proving that all was absolutely okay with the provider. So here we have all these files. What this is, and I haven't even begun to open it or read it, is basically a freedom of information kind of request. A request for all of the transcripts and documentation dealing with our health insurance case, so that if I needed to go to an attorney to battle this insurance company, I would be able to have this with me. Again, I haven't gone over this yet. I wanted to show you at least one form which has been used a few times now in terms of denying claims, all based on that one reason that I gave you earlier, which was the inadvertent transmittal of incomplete information on the part of the provider, not us, which we didn't find out until later, and which in fact has been corrected. Okay, this is what's called an NUBC form, National Uniform Billing Committee, established in 1975, over the years has produced this form, and it's customarily used by providers, both nonprofits and private providers, hospitals, clinics, etc. And this wonderful document, this form, has 80 code areas, in extremely small font. Most of the time the form is filled out electronically. Some of the time it's filled out by hand. If you have one digit missing or one code not filled in, does the insurance company call to find out, hey, you missed this? You had it last month, why isn't it there this month? Kind of a more humane thing to do, it would seem to me, also quicker. No. These omissions, which in 3 instances have been the fault of the health insurance provider, and I hope they're in the transcript, have been used to deny claims or postpone payment. NUBC, I believe, is not a government institution. It's probably part of a self-regulation type of effort. I may be wrong. I do have a call into them to find out, because I like to know what NUBC is about. Okay. If it wasn't that I was dealing with all that, which has consumed anywhere between 10 and 20 hours a week, including 2 phone calls today and one that I'm going to have after 4 o'clock today, I have another story. Boy, am I lucky. Okay, so recently, actually I still have it, I have a bone spur in my right foot, heel spur. I go to a podiatrist on September 7th. And on that first visit, very nice gentleman, he puts my feet, both of them, in a whirlpool of hot water. He does x-rays. He sprays my right foot, and he gives me I would imagine a cortisone shot to numb the pain, prescribes some medication which I could not fill because something was wrong with something about him at Walgreens that should have given me a clue. And for this particular day, also and a boot to lift up the toes, because in addition to the heel spur, I have plantar fasciitis for the first time. Okay, that initial visit didn't take long. $2,864 was billed. Putting my little toes into the whirlpool for 10 minutes, $200. Surgery, I guess that must be the needle, almost $1,000. So $2,864 for that visit on September 7th. We come to September 14th. September 14th, a few pages worth of bills, charges, okay? These charges amount to $9,552. Surgery is mentioned ad infinitum on these forms. When I finally called about this on a subsequent day, I said, what could he be charging for? And he said, well, I really can't tell you. As a customer service rep, you would have to talk to the claims people. Talk to the claims people, they couldn't figure it out either in terms of the codes, because they said repeatedly, it's about the codes. So we must be talking about that form that I showed you before. The only thing that the claims representative indicated, did he shave epidermal or dermal tissue? Okay, no, there was no shaving. But what's most alarming about these bills is that there was no appointment on 9/14. I had called to reschedule. So, $9,552 worth of charges on a day that I wasn't there, so that obviously surgeries did not exist or anything else. That brings me to September 20th. I was there for a follow-up visit. I had not gotten these explanations before 9/20. So on 9/20 I went for a follow-up visit. And basically he put my little toes in the whirlpool again. Very nice. He examined me, asked me rather forcefully if I was doing exactly what he had prescribed as the way to go. And I said yes. And for that, he billed the insurance company $1,400. I called up the claims department. They said, thinking, gee, can they help me out here in terms of identifying what to do? And they said, you're really on your own, basically. Why don't you talk to the provider? And their first word was negotiate. Why should I be negotiating on surgeries that didn't take place on a day where I wasn't even there? They ultimately gave me a fax number in which to put in this information to the claims department, and perhaps somebody else told me I should take it to another division of state government dealing with health performance by providers. Apparently an oversight. But here, the health insurance company did not say, whoa, you're trying to save us money. In fact, we've begun to get checks with regard to these. He indicated that he was in network. No, he's not in network. He's out of network. So we were getting checks, which I still have, dying to give back to the insurance company. Same insurance company that I'm battling with on the other situation. So I haven't even begun to deal with this because of the time that I'm spending on the original story that I told you. I've been a deputy commissioner with a $2.4 billion budget and over 700 staff. I've worked for 2 mayors at high levels. I'm used to detail. I'm used to regulation. I'm used to laws. This initial case has beaten me. Now imagine a family that's working, trying to bring up their kids, trying to enjoy their lives. And they have to deal with insurance companies that know every single trick to delay and postpone or not pay. A recent book came out, American Sickness, how healthcare became big business and how you can take it back. Written by Elizabeth Rosenthal. She's done the circuit with regard to this book. It's very popular. I in fact bought it and gave it to my congressman. No, I don't advocate for people trying to take health care back. I do advocate, and I love my new t-shirts, Medicare for all. Single payer. You do away with this. You enjoy your family. You provide economic growth in the right way. You increase the cash flow of 95% of Americans as you remove an unnecessary layer. I encourage you, as I've done before, to go to the website fixithealthcare.com and look at the 2 documentaries on this, and then share that information with your friends, your relatives, your co-workers, anybody that you love, and a few people that you dislike. It's key that we have information. I want to say something just in parting, hope I'm not taking too long, on this form. I say that the National Uniform Billing Committee was established in 1975. I bet you dollars to donuts that it had only maybe 25 codes at the first time that they did this. And now it's grown to 80. I kind of know a little thing about that because of the staff that I had at the Department of Social Services. I had 100 people that were writing regulations. Why did Glass-Steagall become 33 pages and then we have Dodd-Frank at 1,000? Simplification should be a goal of government. Simplification of our lives so that we can enjoy them here in the United States of America should be one of the focuses of attention of fighting for Medicare for all single payer. Thanks.